Holly describes how she was pinned down by staff and made to feel like a caged animal. Our health correspondent, Ashish Joshi, reports.
Totally over-medicated. It was so fast, the weight gain. You think of putting a stone on a month. Can you imagine what that's like? It's heartbreaking for Holly to see, heartbreaking for us to see. And you just worry about the medical implications of it as well.
Holly's drastic weight gain was a side effect of the medication. It was part of her mental health treatment. But staff at the unit where Holly was held didn't know how to deal with her autism.
They were quite rough. They would grab you. You'd have, in my first unit, you'd be on the floor, either on the mattress or on the floor, the hard floor, and you have one person on one leg, one person on the other leg, one person on your arm, one person on the other arm, and someone on your head.
Holly's condition means she doesn't like to be touched. Pinning her to the ground would only increase her anxiety. On one occasion, she was restrained for nearly 4 hours.
It doesn't really help you learn to cope, because you're just having someone physically stop you for the time being. And there's not someone telling you your therapies, coping strategies.
Her mother Emma told me she felt helpless watching her daughter's condition deteriorate.
Heartbroken is the word, really. Nobody wants someone to lay hands on your kid at all. You know, you think if I was there, I'd stop them, because she was only being herself.
Holly and Emma say the staff at the unit were poorly trained and simply couldn't cope with people with autism. It's a recurring criticism of what's been described as a broken system. Yesterday on Sky News, we reported on the case of Bethany, an autistic teenager locked up for 24 hours a day in solitary confinement. She's just one of more than 2,000 people with a learning disability or autism currently being held in a secure unit in England. Of these, 235 are under the age of 18.
Tomorrow, the Joint Committee on Human Rights will publish a damning report on the detention of young people with learning disabilities and or autism. Their evidence will point to a failure to protect our most vulnerable young people and a complete lack of confidence in the system. In direct response to Holly's case, NHS England told us they're working to improve young people's inpatient services and reducing restrictive practices. Holly says she feels better now, but she wants people to know what really happens inside these units.
I'm feeling more free to be part of this and to have someone hear what I had to say.
We would move heaven and earth to stop it happening again. We would never ask for that sort of help ever again. We'd work ourselves into the ground if Holly was really low again, to that point where we needed help. I don't think we'd ask.
Ashish Joshi, Sky News.
I'm going to talk more to Ashish in a moment or two, but I just want to take you through the latest figures, which show a sharp rise in the number of NHS facilities that care for people with learning disabilities or autism receiving the lowest possible rating. Here they are. Last year, the Care Quality Commission said that 1% of services for patients admitted to hospital were inadequate. But look at the change. That's risen tenfold to 10% this year. The government spends an estimated £8 billion a year supporting people with some form of learning disability. But there's a big disparity in the cost of that care. It takes around £650,000 a year to care for someone with learning disabilities in the community or in a residential home. But nearly 3 times as much, around £180,000, to look after someone in a mental health hospital. And as I say, Ashish joins me live now. And Ashish, I just want to pick up on something you said towards the end of your report there about this Human Rights Committee's reporting, and you expect it to be a damning report tomorrow. Is anything likely to change, though?
Well, it has to change. This is a broken system which has been recognised to fail these vulnerable young people for so many years. Now, the people we've been talking to over the past year, case after case, including the one we did last night, including the one we did today, they've all been contributing. They've been telling their stories to these MPs and their peers. Jeremy has been giving evidence about Bethany's case. Now,
We know that this is going to be a damning report. We've spoken to the politicians who are putting it together. What really needs to happen, the families will say they are sick and tired of review after review. What they want to see is direct change. The biggest change that can happen, and what we will really be looking forward to this evening and tomorrow morning, is to see if there will be a change to the Mental Health Act, whether there will be provisions to stop people being locked up, people with learning disabilities or autism, immediately being thrown inside one of these units and being locked up. That would be the strongest
But I mean,
indication.
the weird thing about that is that, as we've expressed there, it's actually cheaper.
It's
to
much
care,
cheaper.
To care for patients.
It's
in the
certainly cheaper.
community.
It's cheaper and it's better and it works, but it's convenient to throw people in these institutions into these units which are managed by private companies. The people we've been speaking to keep telling us that these private companies use agency staff who are not equipped, who are not trained, who can't deal with the people they're supposed to be dealing with. So that's a system, a failure which goes right through the system, which needs drastic change. And it is cheaper to look after these people in their communities, but there is no capacity to do that because that requires, that requires manpower, that requires setting up more community units, because as soon as one person leaves one of these units, is deemed to be well enough to go back into the community, somebody else will take that
Be
place.
interesting to get the Health Secretary's views on all this. I mean, he's been doing quite a few interviews surrounding the election, at the moment, but he won't talk about this.
He's been tweeting lots, so clearly he's on social media. He knows what's going on. He hasn't spoken to Sky News yet. The interview bid remains open. Mr. Hancock, if you're watching, please come speak to us, because the families are demanding answers and they need to know what's going wrong in the system and how their children can be better protected.
Ashish, thank you very much indeed. Our health correspondent, Ashish Joshi there. Now,